Congressman Brad Wenstrup is back in studio for a full hour of discussion, and it's just too bad we don't have anything to talk about. Welcome back, Congressman. It's always great seeing you.
Thanks, Brian. You know it's my pleasure to be here.
Yeah, a little under the weather he is, so if he sniffles or coughs a little bit, he is under doctor's care. Even though he is a doctor, he has to rely on another doctor to get prescriptions and stuff. So I wish you the best of health.
Well, that's kind of a written rule. Don't treat yourself.
Yeah, physician heal thyself. That's not a thing. No.
Then we try usually first, and then when we fail, then we go to the specialist. But anyway,
Joe just said something about Dr. Fauci, which is number one on the list. But you had a good relatable. You were listening to my conversation with Dave Hatter coming in, and we were talking about artificial intelligence and the scary, scary reality of that. It's almost one of those things I don't even want to think about because I'm so worried for our future, and just simply the idea that you're never really going to be able to truly believe anything you read or hear, see or hear anymore. So anyhow, it's been that case with what you read for a long time, but people have been manipulating the human word for forever on print, but that's someone's take on something. And of course, if you sign someone else's name to that, then that's easily actionable. This is something completely different.
Yeah. This is, out of nowhere, but, you were talking about AI, and we just did a panel yesterday. I did it at the Ronald Reagan Institute, and we had some really talented people that are there to assess threats to the United States.
Yeah.
And so it was biothreats and AI was the topic. So first of all, recognizing the threats and then the use of AI. And there's always good use of AI and bad use of AI. And I always talk about, I don't think the Wright brothers thought, well, maybe someone can take this and fly into a building someday and kill 3,000 people, right? But there are people out there that think of those things. And that's the world we've always lived in. And
naturally. So
we've got this technology and people start thinking about how they can use it to conduct scams, to do whatever they want to do. So that's very interesting because you can use AI, and this will tie into the whole COVID thing and potential biothreats, bioweapons. But you can use AI to try and predict a coming virus. And I think that's a better way to do it than to actually make the virus in the lab.
The little gain of function research. Here, let's see if we can make one that kills every single living thing it comes in contact with. Oh, that's a good idea.
So going forward, use AI that way, and only nefarious people will probably want to actually create the virus in their lab to see, using humanized mice, will it actually kill you? So it replicates what a human would be. So just very interesting. We had a great panel yesterday, and I wish I had the link to it for you, but people can watch it. It was very good, but at the same time, very, very frightening.
Sure.
But that ties into the reality of all the things that we've seen within this whole COVID situation. Sitting on Intelligence Committee, when COVID hit, I had been looking at bioweapons by our adversaries before COVID hit. Mm-hmm. And then when COVID hits, we're doing research, and at first we're looking for ways to treat people. I'm on the phone every day during lockdown, looking for ways. How are we treating people? He even called infectious disease doctors in China. Give us some idea. What's going on with the body? How do we treat it? At the same time, we find this article from 2015 where one of our scientists, Ralph Barrick in North Carolina, was working with Dr. Zhengli Shi in Wuhan, China. And they created a chimera, or a new virus made from two different viruses and putting pieces together. And our thought was, oh my gosh, this can be done. So now my mind's going to bioweapons, not just COVID, but, bioweapons.
Anything,
yeah. And so, we started digging deeper and deeper and deeper and seeing what's going on in the labs in Wuhan today, et cetera, et cetera. And, everyone knows COVID, obviously, and all the questions we have about the origins of COVID and why it's important that we try to figure out the origins of COVID. But the purpose of the committee that I chair, subcommittee that I chair, is to hopefully give us some ways to be prepared or maybe predict and then maybe prevent the next pandemic. But we got to look into what went wrong. What did we as a government do? And what is this relationship with the United States and China in doing this type of research? How are we issuing grants? And it's pretty disturbing. And that's what I want to get into today, because in the last few weeks, we've had Dr. Fauci in for 2 days. We had Dr. Collins, who's head of NIH, Dr. Fauci being the head of NIAID, which is infectious diseases. And then we've had Dr. Morens, who worked for Dr. Fauci. We've had Dr. Dazik, who was head of Eco Health Alliance, who was getting funds from NIAID and NIH to do gain-of-function research. In China, we saw a conversation he was having to try and get a grant from DARPA, which is the DoD Advanced Research Program. And in his private conversations, he's saying things like, well, what we want to do is, put these, what's called a binding domain, on a virus, which makes it stick to the human cell. And then a furin cleavage site, which gets you into the human cell. But he's saying, but we are not going to tell them that we're going to do this in China. And the Chinese are on this email. And we're not going to tell them we're doing this in China because that's a BSL-2, which is a safety level for the lab, biosafety level that's too low.
Oh, geez.
And, every scientist was saying, you don't do any of this stuff except at a 3 or 4.
Yeah.
So he's already planning to deceive the government. Now, they didn't do that when they submitted the grant, but they still didn't get the grant because DoD said that is way too risky.
Yeah.
To even be doing it. So then they go to NIH and they get funding.
Well, there's so many funding sources available from the federal government. I can see how they'd forum shop like that.
Okay. And not just that. So here's what we learned from Dr. Fauci when you're trying to get this grant. So they submit the grant and there's an advisory board that decides, if they're going to issue the grant or not. I don't know who's on the advisory board, but I want to find out. I also want to find out if those on the advisory board have any clearance from CIA or FBI to give them warnings about going to a foreign lab. We asked Dr. Fauci, do you have any oversight over that lab that you're sending money to? And he said, I wouldn't even know how to do that.
Oh, my God.
Okay. So the board decides they get the grant. Dr. Fauci told us, and you'll see this when we release the whole transcript. He told us, he said, well, once they approve it, I just sign it. Okay. Now you have this group, Eco Health Alliance, that's supposed to submit reports. I don't know if it's every 4 months, 6 months on the progress of their work.
Right.
They weren't doing it.
Reports on the purpose of the grant. Like, here's where the grant money went. Here's what they're doing with that money.
Yeah,
and here's how things are going.
Exactly.
With the research.
They weren't doing it. And NIH was not calling them out on it. And now they're pointing fingers at each other. When we asked Dr. Fauci, is like, well, don't you want to see what's going on with the research? And if they're doing it, he says, that's over in compliance. So just one hand washes the other. Left and right here is what we're seeing. And that's how our government operates. So you can bet when we do our report, these are the type of changes that we are going to make. And hopefully we can get this into a legislation and make it become law.
Well, going back to a point you made before we came on air, and you say you don't even know who the people are that provide this clearance and make these approvals. You don't know. You're on the panel investigating this, and yet you don't even know who the key players behind the scenes are that authorize this type of work. They're not providing you that information.
Well, we realize now after Dr. Fauci's testimony.
Oh, so that was a new revelation.
That was a new revelation.
Okay.
That's what we're finding in this whole thing, Brian. We think we're turning over all the stones, and once we do, there's another stone.
There's another stone, yeah.
And so that's something we're going to seek. And what's been happening with HHS when we're seeking information, Health and Human Services, they stonewall us, and they don't give it to us. That should be automatic. Congress, who funds your agency, who has oversight over your agency, you shouldn't be able to say, we're not going to give you that. We're having to subpoena them. To get information, and that'll probably be what happens when we want to know who the characters are in the advisory board.
And they'll fight the subpoena. You'll end up in a protracted court proceeding, which will take us past November, and in their minds probably, or hopefully, to a Democrat administration, and your loss of Congress perhaps, and the end of these pesky panel looking into this type of thing.
That's what it's become. That's the pattern
see the writing
within our
on the wall.
Agencies. And we can do a whole section on what we need to do for the agencies.
Full hour of power. We were talking about the Fauci hearings, and I know you had. It's live. It is not AI, Joe. Just to make sure everybody knows that, because I need to verify. And am I live or AI? Yeah, I know. We go down that road all day, couldn't we? Anyway, Dr. Fauci had some more comments and thoughts and information about how those Fauci hearings are going. But, I mean, on the heels of your comment about it, nothing is more distressing to me than the fourth tier of government, this administrative state, which doesn't even exist in the Constitution, was a whole cloth creation of the Wilson administration and blown up in subsequent administrations. You can't fire them. You can't get rid of them. And here they are. They work for us, the taxpayer. You said, that you pay the bills. Ultimately, I'm paying it. I mean, right. This is a representative government. You are doing the will of the people. At least you're supposed to be. So you get elected to represent us. We are the ones that are footing the bill for gain-of-function research at a blanking Chinese lab.
Yeah, we take your money, my money too.
It's slavery, labor.
And then Congress funds it, approves it, basically, to send the money out the door. But we don't always see what we're getting. You mentioned the agencies. When our country started, we had 3 agencies: State, Treasury, and War. And I think everyone would agree those are things we need.
Yeah.
Okay. Now look where we've gone. 17, 18, 19 agencies, and they're huge. And like you see, you can't fire them. And this is the problem I've had as we've gone through this. When I first got elected, I thought, term limits is probably a good idea. Well, then I realized if you have term limits, the people running the show are unelected people that are called staff on these committees and everything else, because you haven't been there long enough to really understand, especially like armed services, for goodness sakes. Mac Thornberry was a great chair of armed services. He was there 22 years, and that's why he was so good, because he knew all the ins and outs. You couldn't fool him. So the military is the only place where we have a thing called a code, Uniform Code of Military Justice, where unethical is unlawful. You violate the ethics of the agency, the military, and you go to jail or you're let go. So we don't have that in our agencies. And what we've seen over and over again, just look at what was done with the whole Russian collusion thing. You have people within the FBI doing horrific things that violated their rules. Yeah. The Inspector General even said that. Where'd they go? They just kind of left and go on CNN. And there's no criminal element. And that's one of the things we are trying to change when it comes to the FISA court, which was abused terribly during that time.
Yeah.
So we have criminal measures now put in place for people that abuse that. If we get it in place, let's say we've written it up. Now we want to get it into law. But going back to this whole process with origins of COVID, when we go to the agencies and ask them for information, we're not going to give you that or this and that. We found in one case that a FOIA, I think it was by a group called Right to Know, had more information than what they gave members of Congress, because they redacted a lot of stuff that wasn't redacted in the FOIA. You can't make this up.
So a private, outside, non-governmental entity asks for the documents. They're allowed to get them under the law, for Freedom of Information Act. They ultimately turn them over, probably after litigation, dragging their heels. But they do give it over. You ask for it because you're entitled to it without a FOIA request, and they redact the hell out of it.
They redact it, and that's only after we've gone back and forth fighting them. So in many instances through this investigation that we're conducting, we end up threatening subpoena. That's when they start to come back with lawyers to negotiate something. It's unbelievable. This should be automatic. You should have nothing to hide from Congress with your official work. But now we're finding stuff that was in their unofficial side. And you have Dr. David Morans, who worked for Dr. Fauci, and we got some of his official emails, and what he said in them to some of these scientists that claim that this came from nature. He said, well, you know what? Contact me on my Gmail, because I'm getting FOIA'd all the time. And I won't even use the expletive that he called the people that were FOIAing him. And he goes, but put it on my Gmail and I'll delete whatever I don't want showing up in the New York Times. And there's nothing wrong with that. Well, the National Archives is after it, but we're asking the National Archives where they are with their investigation on Dr. Morans with this.
Yeah.
And they have not given us information. And so we probably will have to subpoena, but we're continuing to try and find, well, what was in his Gmails when he was talking to these people in particular. That's all we want.
Well, it's like Joe Biden using 14 different aliases sending out emails. You know, all of that is presidential business, whether he wants to call that or not, or vice presidential business, the case may be. And it takes investigations and blow-ups and, allegations to even reveal that this is going on. It's, and these are the things that we know about, I mean, it took COVID and a disaster like that to find out how bad things are behind the scenes with regard to accounting for where the money is being used and how it's being used.
Well, what's sadder, though, is that there's half of our government, half of our elected officials that don't care to find this out.
Well, see no, hear no, speak no. I'd rather not know about it. It's like a toddler with his hands over his ears and closing his eyes going la, 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 la. That doesn't make the problem go away. Matter of fact, you end up with COVID. 726, 55 KRCD Dog Station. More with Congressman Wenstrup. We do have a lot of topics to try to get through, and we'll try to manage that. Thomas with Congressman Brad Wenstrup. Been spending a lot of time on Dr. Fauci. The Congressman has been in the hearings with Dr. Fauci trying to get to the bottom of the gain-of-function research that was going on the Wuhan Institute of Virology, and our response and reaction to COVID-19. Was it a right one? Was it a wrong one? What do we learn from all this? The obstructionism that he faces every single day trying to get documents and information that should land in his hand without objection. Of course, that is not part of the left wing's game plan. And it's, I think, an effort to dodge and prevent and deny us from knowing the truth about this. And one of the things that Fauci's always been doing, dodge, dip, duck, dive, and dodge on, the 5 Ds of dodgeball, was this definition of gain of function. He initially was trying to deny that we were even doing gain of function research in there, but even to the layperson, how can you deny that? And does really merely changing the definition a little bit free him from any potential liability or for having responsibility for this going on?
So it's interesting because when we started to get some of the emails, there's a 2020 email that we found that was amongst Dr. Fauci and those scientists that he got together that wrote Proximal Origins, trying to show how this would have come from nature. And I'm not saying that's not plausible, because viruses do come from nature very often. But
well, this one did. It was mutated by human beings with gain-of-function research to make it contagious to the human being.
So when we were talking about this, and in this email, he's talking to these guys. One of them ends up saying, "Well, my job." Or my focus is to discredit, I think that was the word he used, discredit the lab leak theory. But conversation early on goes from one of these scientists saying, this looks engineered, Dr. Fauci saying, well, in fact, we know that they're doing that type of research in Wuhan. And then this same group goes out and tries to debunk it, but their internal emails keep saying, we still can't really rule out engineered because of the way this looks. But that's not what got out to the American people, right? What got out to the American people is Dr. Fauci on the White House lawn saying that this came from nature. Okay, that aside for a second, you talk about gain of function. A lot of people, your listeners especially, have seen the exchange between Senator Paul and Dr. Fauci, where he said, is the NIH funding gain-of-function research in China? And he says, no. And I think he even said, you don't know what you're talking about.
Right.
And, but anyway, so now what he said during these, actually, they're transcribed interviews, Brian, so these are closed.
Yeah.
And we'll release the transcript. There will be an open hearing with Dr. Fauci. He agreed to that coming up. But when asked about that now, he said, well, what I was thinking about was our operative definition. The operative definition is when you're of gain of function is when you're trying to create something that could create a pandemic, not just
intentionally so, like doing it for the purposes of biological warfare.
Right. And well, no one else ever heard of this. And I said to him, listen, for the last 4 years, I've been looking at every article I can get my hands on about this type of research and what's published, and no one ever differentiated between the two when you talked about gain-of-function research or the creation of a chimera. And so this
goes back to your airplane analogy, that it can be weaponized is certainly possible, and that the research that's going into this could be used to weaponize and create a biological weapon. That's the ultimate decision by the end user, but the research is going on, period. And it is manipulating these viruses to make them more contagious to human beings.
Right. And
for whatever good or bad, that's what's that's gain of function definitionally.
Absolutely. So, in that vein, though, when a letter was sent and asked about that gain of function research, and that particular comment with Senator Paul, I believe, is how it was addressed, too. It came back describing this operative definition. Well, guess what? The NIH website did not change their definition of gain of function research until the exact same day that letter was sent.
Shocking. Literally no one, at least no one in my list.
You be the judge, right?
Indeed. Stick around more with Congressman Brad Wenstrup. Congressman Wenstrup's in the studio. We're going to do a couple more fun facts that he's learned from the testimony during these hearings about the origins of COVID, including Dr. Fauci's testimony. We've already gone over the idea that he acknowledges basically that gain of function is going on. We're over that fight over the definition hurdle. I think, at least factually speaking, on its face, it was gain of function, and there's no way he can say it's not. Okay, so COVID, he does not deny any longer that about conspiracy theories. Remember when it first came out? Anybody who said, this is a lab leak, look, there's the Wuhan Institute of Virology right there where the origin of COVID on the street came. And you were accused of being a conspiracy theorist if you said that. You were bat crap insane. No joke, no pun intended. No longer.
Yeah, so he and Dr. Collins, they both said, no, it's not a conspiracy theory. So we got from Dr. Fauci the answers to the questions we wanted, and we did it in a civil way. At the end, he said, you guys were very fair. We didn't yell at him or anything like that, but we certainly got a lot of answers that we wanted answered. But it was interesting because the ranking member from the Democrat side, who was a physician, was not there. He came for the last hour on the second day when Democrats were asking questions. But it was interesting because on the first day, he puts out a press release saying Republicans just hammered away at a conspiracy theory and all this kind of stuff. And I was like, that's not what we did. And we just asked him about it, and he answered the question. So the next day, we submitted his press release for the record and asked Dr. Fauci, was Dr. Ruiz here yesterday? Did you see him here yesterday? He goes, no, I did not. So what I'm trying to say is, unfortunately, on the other side, they're just trying to make this some political thing as opposed to, can we just ask him questions and get answers? He said it's not that, but these are some of the interesting tidbits too.
Perk your ears up, folks. This is where you can all walk around and say, you see, I told you so. Go ahead.
We asked him where the 6 feet of distancing came from. Where did that come from? He said it just sort of appeared. We said, so there was no science behind it? No. We asked him the same about masking. No, there was no scientific study behind the masking. And, I think about it, at least we should have probably told people that had COVID, don't wear a mask, but stay away from people.
Yeah.
Right? Because if you're wearing a mask when you have COVID, you are now exhaling COVID and putting it into a mask that you're breathing back in, and anything else that's coming out with it. You wouldn't blow your nose and put your handkerchief over your face, right? So at least we could have done that in relationship to mask. Let's talk about the mandates for a second, which I think your audience and I would all agree that was a horrible thing.
Horrible.
We took the doctor out of the equation. You had a politician saying you need to get this shot or
you will be fired.
Or you're fired, right?
Right.
And he said, I don't think I understood the psyche of the American people. And that's exactly right. I mean, I will tell you, going back to the Trump administration too, I said to Secretary Azar, America needs to be hearing from the doctors treating COVID patients. Yep. And you know what? We still do. We still need to hear more from the doctors treating COVID patients. And also hear from the doctors that can tell you what adverse events may have occurred from the vaccine.
Well, someone sent me a picture of an ivermectin package, and that was one of the things that we were immediately told, no, it's a horse medication. You cannot use it. It will not do anything. Absolutely verboten. And then they told the pharmacies not to provide, to even fill prescriptions for it.
Yeah.
When in the history of our country has that ever happened?
If you prescribe anything at a horse dose, you're going to have a problem. Yeah. That's not what was happening with ivermectin.
Right.
They were doing it at the FDA-approved human dose, Granted, it had never been studied for this, but guess what? We didn't have anything else.
Didn't have anything else. And, that's how research is done. You try something that's existed for a while when new pathogens come out, and sometimes it ends up working in a way that wasn't expected, that wasn't initially designed for. It was designed for parasitic infections, and people claim that they're taking it and it helped them get rid of the COVID. And for some people, they swear by it.
And people were afraid of dying. And when you're a doctor...
Yeah, like Ozempic. Joe said Ozempic for weight loss when it was for diabetes, yeah.
Yeah, that's what, off-label.
Viagra for...
But you're looking at somebody who's worried they're going to die, and they may be getting very sick.
Yeah.
And you don't have anything else, but this is do no harm. So let's try it.
Try it and see if it works.
And there is some science behind it, too, by the way.
Well, there is. So social distancing, made up, whole cloth, sphincter inspired. Masks don't work. They never did. Why were we forced to wear them and lose our jobs for not getting a jab? When, in fact, a lot of people didn't for religious reasons or just concern reasons. And you know what? I'm sure glad I never got it. Hasn't hurt me any. 745, 55 KRCD talk station. And I suppose someday we'll get to the bottom of how dangerous the jab was. One of my listeners, Maureen, my favorite conspiracy theorist, joking around with Maureen, said, what about the weaponization of the vaccine in terms of going after our health?
Well, I think for those that were so vulnerable and were dying, and we did lose 1.2 million people to COVID, emergency use was appropriate for the vaccine because we knew that they didn't get as sick, less likely to be hospitalized. But I kept saying, and this is where I have debates in the committee, is I said, you cannot say this is effective when we don't know, or safe, when we don't know long term. And Dr. Fauci even said, you can never say something is 100% safe.
Right.
Because there's always side effects. But yet I've got some physicians from the other side of the aisle just keep saying it's safe. And I'm like, you can't say that.
No.
And effective means what? People got less sick, but they still got COVID.
Yeah, multiple times.
So you don't say it's safe or effective. It's not effective like the polio vaccine.
746, 55 KRC, the talk station. One more with Congressman Brad Wenstrup. Real quick, returning back to Congressman Brad Wenstrup, we got some more final things that we want to go over with here. I'll let you choose the direction of the conversation.
Yeah, well, let's just talk about some of the process. We already talked about this, how government agencies refuse to answer and people not responding to subpoenas. I mean, what kind of a world are we living in today where law and order is basically thrown out the window? Do whatever you want and see what happens. And I think a good example of that would be Hunter Biden ignoring the subpoena that came his way.
Oh, yeah.
And so the Judiciary and Oversight Committee announced last Thursday that Hunter Biden will appear for a closed-door deposition on February 28th, and it's part of their impeachment inquiry into his father.
Right.
And so the committees have several depositions scheduled with business associates of the Biden family. I use the word business loosely, I think, in that situation, but the Biden family later this month, and that's into February. So Hunter Biden's attorneys now confirmed the Republican statement. Okay, they confirmed this statement without explicitly saying that Biden would attend the deposition, which is interesting. You're a lawyer. You know how to look through those kind of wordings, and then they can say, well, we never said he'd show up. We just confirmed that he's scheduled.
Good
So we will see what happens, and that's according to the report. But, you think about that ridiculous stunt. I mean, the American people should be grossly offended by seeing the son of the President of the United States ignoring a subpoena and then obnoxiously, in my opinion, having a press conference outside the Capitol. Yeah. That is a
excrement-eating grin on his face, basically the big metaphorical middle finger.
That is such a slap in the face to the institution called the United States Congress, which is made up of the representatives of the people. So anyway, he showed up January 11th when they're having a hearing. I mean, this is just...
Yeah, I don't understand where he's coming from. It's almost like you want to conclude that the guy's back on drugs again. It just seems to be so strange. I don't know what strategy that they think they're utilizing here, or to what end this strategy is ultimately going to serve his interests. But, if I was his lawyer, that's not the kind of advice I'd be giving him.
Well, you hope that, I'm trying to, as a father, I'm trying to teach my son of what was the premise of truth, justice, and the American way. he doesn't seem to be getting fatherly guidance on that in adhering to the system and being part of the system. And if you have nothing to hide, you show up. So we'll see what's happening.
Even if you have something to hide, you show up. It's a subpoena issued by a congressional oversight panel. They have the right to do that.
That's exactly right.
I think if they issued me a subpoena, I might scratch my head and wonder why. I might have maybe a legitimate reason to move to quash it, but at least I'd get a hearing on it first, and I'd have to follow what the judge said at the hearing. Okay, I'll show up. I don't know why I'm here, but...
So out of the goodness of the heart of Congress, we have put a hold on the contempt of Congress that was coming his way for not adhering to the subpoena the first time. But
he's going to do it again.
But they're going to issue new subpoenas for Hunter Biden as necessary. So Comer has committed to letting Hunter Biden testify at a public hearing after he deposes him first. And I promise a release of the deposition quickly after it happens. And I think we're all waiting for that.
No doubt about it. But what giant catastrophe will befall the American people that'll take it out of the headlines? That's what I'm waiting to find out, Congressman.
You know the drill.
I do know the drill. Been down this road many times. 755 Kansas City Talk Station. Brad Wenstrup. It always is a pleasure to have you here, and I can't thank you. And I know my listeners really fully appreciate you coming to the studio. It makes the conversation easier, and we can continue off air and kind of set the stage for the next segment. And it's very informative, and I'm really going to miss having you around after November, but I certainly understand your decision making along those lines. But you'll be back before the end of the year, right?
Absolutely. You know, I'm the congressman until January 3rd of next year.
And you are still very busy. I know you are still working hard for your constituents, and God bless you for it.
Absolutely.
Get well, my friend. Come